Hello, Millennium Live listeners. Welcome back to another episode of the podcast. I'm your host, Connor Toohey, and I have a great partnership series that we're doing at Millennium, and I'm happy to continue that with another great partner, HealthSnap. This episode is focused a lot around remote patient monitoring and chronic conditions management. It's a great episode, so if you are in the healthcare providers space, this episode is going to be really interesting, and we have two great guests. We have Samson Magid. He's the Chief Executive Officer and Co-Founder of HealthSnap, our sponsor today. He is joined along with Angela Orsky. She is the Senior Vice President of the Value-Based Care Division and Clinical Integration at Prisma Health. So I want to thank Samson and Angela for joining us today, with HealthSnap being the simplest way to manage chronic care conditions in a remote care world. They bring care teams together with the power of integrated remote patient monitoring, or RPM, which we'll refer to in this episode, and chronic care management, or CCM as we'll refer to it. They can deliver proactive patient care, improve outcomes, and drive that revenue, which is important. Samson, thank you so much for joining. I want to start the conversation with you as one of the co-founders of HealthSnap. Curious of what drove you to start HealthSnap and just originally kind of the mission and what the company aims to solve.
Yeah, absolutely. Thanks for having us, Connor. The mission at HealthSnap is to empower people living with chronic conditions anytime, anywhere. For me, this was a personal need. My lifelong dream was to actually go into medicine as a practicing physician. I did everything all the way through the MCAT. And unfortunately, the year that I was about to go to medical school, my grandfather passed away. He was my role model growing up. And unfortunately, like half the US population, he had multiple chronic conditions his entire life. He had a heart attack in his late 40s. He was diagnosed with type 2 diabetes in his early 60s. He had another heart attack in his 70s. He lost his entire left leg because of his diabetes later in his life. And I basically got a firsthand glimpse how our healthcare system not designed to help him manage those complex chronic conditions between his office visits. And he would actually come to me for help and questions and what to do with his lifestyle and behaviors. And there was very little interaction from his care team with his physicians at the providers he was seeing. And so we saw a really big gap in the market where we had a rapidly aging population, a rapidly chronically ill population, and a healthcare delivery paradigm that was reactive, episodic, and delivered in the clinic. And so we set out to flip that care delivery paradigm on its head and help physicians and healthcare systems deliver proactive, ongoing care in the home. And we've been doing that now for almost a decade. We're one of the first companies in the space to launch and scale integrated remote patient monitoring and chronic care management, which as an industry is now turning into a very large virtual care management segment of telemedicine. And we're really excited about the opportunity of the impact that we're delivering for patients like my grandfather that desperately need our help. And, I'll just stop with kind of a statistic. There's 11,000 new Medicare eligible patients a day. That's 4 million a year. And 68% of those Medicare patients have 2 or more chronic conditions. So it's costing our healthcare system over $3 trillion a year in treating those conditions. And our vision is that we can help prevent those conditions and slow the deterioration of those chronic conditions with changing, the way that we manage them at the root cause.
Samson, thanks for sharing all that, and especially with it being so close to home and your family. Angela, I want to bring you into the conversation. Thank you for joining the conversation today. What made you over at Prisma Health decide that implementing a comprehensive remote patient monitoring program and CCM strategy was a good idea? What were some of the gaps and challenges that you were experiencing?
Thank you, Connor, for the opportunity. I love to speak about this work. And you'll see as we kind of go, hopefully, as we go through the podcast, we'll talk through some of the things that we've identified. But when we start early, I want to think about this scenario, and we could use Samson's grandfather if you want to visualize someone. But think about a senior or any patient that is asked to monitor your biometrics, and let's use blood pressure in this scenario. You're asked to take your readings several times a day, and you have to keep up with those. You have to write those down. And then you have to remember to take them into your doctor's office. Let's also think about the patients who often will not share that they have visual or literacy challenges. And we ask them to manually record their readings, bring them into the practice. It's not as simple as you would think. And if we shift to what it looks like for the physician, their patient brings in oftentimes just scrap pieces of paper where they've written down their blood pressure readings. They're not organized. If they not had a visit for 90 days and they are a compliant patient, they could have hundreds of readings. And so your physician sitting in a room trying to look at all of this data and trying to determine what is clinically happening to my patient in their home and how do I create an intervention for them. So problem number one was accuracy and synthesis of that data collection as we're trying to help our chronic care population improve their outcomes and have better management at home. So then we look at fragmentation without having a vendor partner to help us scale. So when we were introduced with HealthSnap, we had about 50 patients that were enrolled in a program, but they were being enrolled as they entered into the practice. So the time that it took to educate them on the equipment and putting the batteries in the equipment and knowing how to take their own readings. You couple that with how do we get this scale to 50 physician practices, which is where we wanted to start. South Carolina has some rural pockets. How do we have the infrastructure to do that? So dispensing one at a time didn't work for us. We didn't have the resources and the logistics to quickly scale and get these items, shipped out to patients' homes. And then the third one was, the patients not knowing or not remembering when to call the practice when they're at home, manually taking their blood pressure readings, and they had an escalation. So adherence was a challenge as well. So we were looking at an opportunity to help patients be more successful in their clinical management at home, helping our providers have a better clinical pathway, and then software logistics component as well.
And all this should end up leading to better health outcomes, which is the ultimate goal at the end. So deciding to partner with HealthSnap is probably an interesting story, especially some of the options that might be out there and some of the calls that you probably get on a daily basis. But how could you really describe, Angela, the RPM programs that you've kind of developed in this partnership with HealthSnap? How did things improve? And really to start, how did the implementation and rollout process work out? Was it easy?
It was easy once we found the partner who had some experience in this space. So again, think about we were trying to learn and build our own and quickly identified there are a lot of moving parts into a very comprehensive program. So we wanted to start with our primary care practices because that's really the medical home for those patients. As Samson mentioned, there's a lot of patients with chronic conditions. So we started with patients who had chronic conditions and really started generating a list to look at what's our patient panel look like? What is the opportunity for us to serve patients? And then how do we collaborate with our physician colleagues in those practices just to generally say, here's a list of patients that meet the criteria for RPM and CCM under the billing guidelines. And now which ones do you feel would be appropriate for participating in a program? So we worked actually with our largest, most advanced internal medicine programs to help us create what the workflows need to look like. What does the interface with Epic need to look like? How will the orders come in? How will the orders be reviewed by the clinician? And it took some work to build that transparently because there were some unique pathways that the physicians wanted to see. We wanted to ease their workflow, minimize the number of clicks that they were having while they were inside the EHR, and then also look at downstream. How do we create a very integrated charge interface and our notes to be all wrapped up from a compliance billing perspective? So started with this pilot with a large internal medicine group who was willing to collaborate and partner with us to build what we felt was a foundational model that we could then begin to scale to all of our primary care practices. A lot of educational sessions for the clinicians so that they could get familiar with the workflows, working through the compliance documentation requirements that are essential for billing, and then working on an integration where the biometric readings would come in a visible format for the clinician so they could easily see the performance of the patient at home. So at any given time, They can see the clinical outcomes, whether they're in the practice or there's an escalation that has been called into the practice by the care manager. It's all sitting right there at their fingertip, and they're not having to migrate outside of Epic into another platform. Samson, is there anything else you'd want to add relative to the onboarding that you found was a differentiator for us?
This whole concept of implementation, and more importantly, Angela is more so talking about how do you implement to ensure a scalable program that's sustainable, is really the crux of successful RPM and CCM programs. So you touched on integration. And if we take a step back, the way that we perceive and think about our implementations, Connor, is there's really 5 key aspects of the program in totality. It's patient inclusion criteria, it's enrollments. So we do dedicated enrollments that are fully white glove service. So it's fully white label to Prisma Health, down to the level of, branded caller IDs and regional area code phone numbers, patient onboarding and activation. So getting devices to patients' homes, educating them on how to use it properly, onboarding them to take proper readings and proper protocols and frequency, the actual care management delivery. So the clinical staffing that HealthSnap provides under the supervision of the physicians at Prisma Health, and then the billing and the billing automation, all of which those 5 components are developed into the Epic interfaces that we have live at Prisma Health at the enterprise level for their Epic install. If one of those pieces is missing in the flow, then you have a program that will have some deficiency that might require, FTEs or staff at Prisma Health to manage, which creates challenges with scaling. And I think that's a really important piece, that it needs to be comprehensive in nature. It needs to be integrated in a way that does not disrupt physician or clinician workflows. And it needs to help support workflow automation to drive the scale and impact that an organization like Prisma Health is looking for. And I mean, maybe Angela, just something to take a step back on the size of Prisma Health in terms of how many, employees, providers, your reach and access in the state, just to talk about, I think, the level of impact we've made and the level of scale that Prisma Health is looking to achieve long-term as well.
Again, if you think about, we were sitting in one practice, 50 patients. We were dipping our toe in the water around what could RPM look like. Scaled this pretty quickly when you think about 12, 15 months, I think, Samson, that we were able to, from beginning project to reaching almost all 50 of our primary care practices. Today, in a combination of a remote patient monitoring and a care management program, we have over 10,000 patients that are participating. So from 50 to over 10,000, in 12 to 15 months is phenomenal when you think about the scalability and how we were creeping along. And again, I think that reflects back to was a program that was already developed that could help bring that roadmap and that strategy to us. So it was a complete plug and play, but certainly there was a foundational component there that helped us get to that level of scale so quickly and successfully.
Thank you both for that. I mean, both of you just jumping off each other a little bit, kind of diving into both what the challenges are and what the solutions that especially HealthSnap is providing. And as we know, and you alluded to this, Samson, but it's more important, than ever to really be delivering that proactive and continuous and remote patient care. And from what I take is that HealthSnap is really leading the charge. Curious, Angela, you mentioned a few great points, but during this search, what really helped set HealthSnap apart in the search process for a virtual care management partner? And when looking for vendors, what are the key factors to decide on and look for in an RPM strategy and having a partner like HealthSnap?
Multiple things. And you heard Samson talk about really the 5 elements that were critical to success. You have to think about it from our lens. It's not just the remote patient monitoring equipment itself. It's very comprehensive. And so one of the things I found beneficial in doing some similar work is HealthSnap brought to us a really robust onboarding process. I mean, we knew the customization that was important to us from our workflows, but to be the one to establish what that should look like is not where we wanted to be in the space. We wanted someone with the experience and the expertise to say, these are the things that will make sense for you. These are the foundational components. Now let's build upon that works for your system and your patients. And so the roadmap was clear. They put the resources into place to ensure that our practices had the right education, and there was great project organization. I mean, transparently, I didn't have to assign a project manager. I was the partner helping support the project, but Samson and his team really led that project management component, which is priceless when you look at, just resources and the roadmap that took. Simplicity of their logistics for device deployment was important as well. I mean, they have a multi-touch point process for patients around engagement, from their initial communication to calling the patients to making sure they put the batteries in the device, they take their first readings. That's some time intensive work from a human capital perspective. And so their team managed all of that. We never have to touch or even know about the deployment of the devices. They managed that completely. We mentioned the EHR integration. That one is a showstopper for us. Without having the integration into Epic, we would not have had scale. We would not have had adoption from our physician and clinical team's perspective, because the workflow and the optimization of their time and the visibility of the data is definitely the game changer for us. On the patient front, we wanted to look at something that was user friendly, but also was comparable to a good experience for them. We don't want them to feel overwhelmed. And as Samson mentioned, their white labeled program really does partner with our practices. So the patient does identify that this team is an extension of our physician's practice. They're not just a vendor that we're outsourcing services to. They are our partner and they are a part of our clinical team. So that integration really helps the patient feel like it is very seamless and that they're in the center of the work that we're doing. And when I speak about their team, the care management component is also that complement of a dedicated resource with our patients. Samson and his team have dedicated clinicians to our practices. So that communication, the workflow, the consistency makes sense. They're not interacting with a multiple team of nurses. They have a very isolated clinician who is reaching back out to the physician and collaborating with them or their nurse. So they learn the practice, they learn their escalation pathways, and they learn the patient, and they develop personal relationships with the patients that also make that patient experience compelling. Patients have said to us on multiple times, this is easy, it's convenient, and that they will celebrate even better outcomes and partnerships with their physicians because they see that interconnectedness between the work that is happening in the office, but the care that we're trying to provide in the home space. And I would be remiss if I didn't acknowledge that HealthSnap has truly been our partners. You talked about how Samson and I can converse back and forth. It really is because it is a partnership. They know us, we know them, and they've been able to flex and build a program that met our needs and, of course, our patients' needs.
That's some high praise, Samson.
Doesn't come lightly. We appreciate it, Angela.
He's worked hard for it, for sure.
Samson, so everything that Angela's saying is terrific, and that really does go a long way, not only in healthcare, but just forming partnerships like this is important to move business forward. And some digital health solutions and their outcomes have definitely become under question as of late, whether they work, whether they don't, whether they're easy to implement, whether they fully integrate into the workflow, as Angela mentioned. But it really does seem like HealthSnap has a unique model to be able to fully integrate into Prisma and I'm sure other health systems is pretty remarkable that you're able to leverage RPM and CCM to really improve patient care and clinical outcomes at scale. Samson, how do you achieve this? And if you could elaborate more on this coming from your end.
Yeah. I think a lot of companies, especially in the RPM and CCM market, Angela, you can attest to this. If you go on most websites, the first thing they talk about is financial ROI. Oh, there's reimbursement. You're going to make all this money, blah, blah, blah. The reality is that a financially sound and sustainable program is the output of a clinically strong ROI program. Or in most cases that we see in the market, it's just focused on financial ROI. Clinical ROI is not even a part of the discussion. I think when Angela first met us, the first thing that we did was lead with our patient outcomes. It's like, if you paint the picture of why are we doing this in the first place, it's we're going to lead to meaningfully medical improvements in patients' health and health outcomes. Oh, by the way, there's going to be financial ROI associated to that care delivery. So it's really easy to say there's reimbursement, but if you have no patient activation, low engagement, and patients don't perceive the value, they will just all churn off. And so driving a high retention, highly engaged patient population because they're actually giving value and outcomes drives everything else. And so for us, we've always put the patient at the center of everything we do. And more importantly, we've always taken an evidence-based approach to the way that we deliver these programs for all the patients around the country that participate in HealthSnap and our RPM and or CCM program. We originally started the company out of academia, so everything we've done has been rooted in science and evidence. And now taking it one step further, even with, because we have Angela on the call, especially, Prisma Health has really leaned into the fact that there are collaboration opportunities to put out research and publications in this field specifically when there's very little literature and evidence prior to the last several years. So we're leading the way in also publications and abstracts and research around the efficacy in RPM and CCM, which we feel like will inform policy when it comes to reimbursement, whether it's at the federal payer level or on the commercial level as well with local markets. So that's the most exciting part for us is the outcomes that we've been able to drive and demonstrate. I was actually looking at some of our recent data just for blood pressure alone. So first of all, blood pressure is called the silent killer. Half the US population has high blood pressure. Most people don't even realize that they're walking with high blood pressure. And it's called the silent killer because there's no symptoms. And, just at Prisma alone, we've seen patients that started on the program that had uncontrolled or high blood pressure. They were already being medically managed. And on the program, we saw 88% of patients improve their blood pressure after already being medically managed. For patients with uncontrolled stage 2 hypertension, so the above 140 on systolic and above 90 on diastolic, we're seeing 21-point reductions in systolic blood pressure and close to 13-point reductions in diastolic blood pressure, which is the equivalent of taking 2.5 to 3 blood pressure medications solely through a proactive care delivery model that's helping early identify patients that are trending in the wrong direction and helping providers get access to that data in a way that can actually inform care plan intervention. So titrating medications, office visits, preventing hospitalizations and ED visits. It's groundbreaking from our perspective. And with partners like Prisma Health, we're publishing these results in various peer-reviewed journals like eHealth and Telemedicine. We presented various abstracts at the American Heart Association. This is cutting edge and from our perspective, the new wave of how we're going to treat chronic conditions. And if you're not doing that as a primary care provider managing hypertension, you're not providing the best possible care to your patients. And we continue to get more data and drive impact at scale to gather more data sets. We're going to continue to see, I think, a refinement in what the best protocols and procedures are when it comes to just hypertension management alone. And that's just one of 40 plus conditions that we support.
That's terrific, Samson. And Angela, what is the impact? What does it have on Prisma Health and everything that Samson is saying here? How does the partnership really help achieve Prisma's long-term objectives, including total cost of care, better outcomes, and patient satisfaction? At this point in the partnership, what are the results?
Samson led very clearly around the focus on clinical outcome assessment. It's developing a program is we all feel like it's the right thing to do. But in all things that we do in healthcare and at Prisma Health, we want to evaluate those outcomes. What is the output from all the work that we're doing? And so we're seeing that early on and sustainable. I mean, this isn't just a glimpse into a few days of the outcomes of the patient. These are patients, the longer they stay on the program, the better their outcomes become. And so let's think about the why behind that. It's not that our physicians weren't actively engaged with their patients. I mean, hypertension and challenges with, and especially, in the state of South Carolina in the South, that's a leading cause for many of our patients of high blood pressure readings. It's the insight into what's happening holistically with the patient at home. And that moment in time when they walk into the physician's office and you're obtaining their blood pressure readings, if we, stay focusing on blood pressure as a result, it's impossible to see what their condition has been over time at home. And this is an opportunity for us to do that. And we're not losing that line of sight by asking them to write those numbers down. It is formulated immediately into their clinical record when they take their reading. The value of this program is the physician is able to see these results summarized. And so we can see the trends. They're not having to manually calculate that. It's being summarized for the physician so they can look at over time, and they can make medication adjustments that are more directed based on some of the missing clinical assessment that they would have had just when the patient is into the practice. The other piece that we also have to understand is it's the role of that care management team as well that HealthSnap provides. The adherence to taking your blood pressure readings, the nurses will call if they're missing their readings. If their readings are out of norm, they'll also make a call and say, did you take your reading today? Did someone else use your blood pressure cuff? What's going on in the home? They'll help triage and identify and then escalate that back to the physician. And patients don't always feel either comfortable or sometimes know their pathways for escalation, or they don't always call the physician at the right time. This program allows that clinical oversight to help facilitate that communication back to the physician, so we get even more real-time interventions for the patients than just those periodic office visits or leaving it directly to the patient to engage back with us. And then our next phase of understanding the total, cost of care impact is to start digging in further into what are those cost savings. How do we take this data and turn it into another assessment or analysis, and then connecting that back to some of our value-based care programs and hardwiring this into those programs as well. And of course, our patient satisfaction, very important to Prisma Health. The experience is one of our leading strategies. We have an exceptional national results and patient experience coming out of our physician and ambulatory practices. So that is a leading advantage for us in implementing tools and solutions that will give them, better clinical outcomes in South Carolina, but also a good patient experience and help them feel empowered to take care of their own clinical needs as well.
I do want to talk a little bit more about the patient experience. I think the last couple of questions I have are directed for the both of you, because I think you both have probably really unique perspectives on this. But from an experiential standpoint, the patient experience is such an important element of having a really good solution. I can start with you, Angela, especially since you're in the system, and then Samson, what you've seen. What has the clinician feedback and the patient feedback been on the programs that you've been using and implementing? Why does it work so well for patients who have now implemented HealthSnap?
Great question. And it's important to us to obtain that feedback. And we appreciate that HealthSnap has hardwired that into their program as well, that we can complete patient engagement surveys and that we obtain feedback from our clinicians as well. One of my colleagues, Dr. David Garau, who helped initiate our initial pilot, shared with us that he's learned a lot himself from the collaboration, and he's been a very experienced internal medicine physician, and he says, I see the way I take care of my patients has already been transformed, and it's just from the integration of all those data points into the EHR and helping to clinically summarize that for him so that he has a better tool in order to determine what his clinical management is going to be. The physicians have also identified that there's actually decreased calls coming into the practice because there's a nurse who's managing and triaging calls on behalf of the patient. Or when those calls do come in, we have an escalation process so we can determine, is it a low-level triage or is it a really urgent one? We've had examples where the HealthSnap care manager has called and the patient was having stroke-like symptoms. And so that was an immediate intervention that may or may not have been identified through that patient. So you look at the totality of what this provides, it can bring in different clinical stories that we didn't even imagine when we were thinking about rolling out an RPM and a CCM solution. And we also hear from the patients very transparently. Many of our seniors are socially isolated, especially after COVID, or they may live alone. This becomes a good social connection for them as well, too. They love their HealthSnap nurse. They feel the engagement with them, and they will also give them insights into what's going on with them, either personally or clinically, that nurse can pick up on and can help us from a triage perspective as well. So we've had just tremendous positive feedback across the gamut gamut from both clinicians and patients.
And Angela, you touched on probably one of the main points I was going to reference as well. So from a patient experience and also the provider side, I bucket this into three unique value propositions. For the first one, it's enhancing the provider-patient relationship because you're getting more personalized healthcare data to inform more personalized treatment intervention. So that alone, I think, is a uniqueness in terms of how we're actually delivering care, to Angela's point. The second is improving access to care. You might, instead of calling into a practice and going through a phone tree, or you might not be able to schedule an appointment for a couple of months, the care navigators that work with the patients at Prisma Health are improving access to care because they'll be able to escalate, hey, this patient needs a refill, or their blood pressure trends are not going in the right direction. They've triggered, escalations that might require titration, and we're actually getting more increased access to care because of that interaction with the care navigator that HealthSnap provides. And then the third one is what Angela just mentioned, is that the social determinants of health, social isolation, loneliness, and depression in an elderly population is an epidemic. It's hard to quantify, I think, the impact that has on other chronic conditions, but just having someone to talk to can meaningfully change the way that an individual's trajectory of their quality of life occurs. So having just the ability to communicate to someone, to have whether it feels like a coach or someone that you can just share something personal, there is proven data that does improve your healthcare outcomes. And so our ability to build a meaningful relationship with the patient that has trust and credibility, and working in side by side with their care team and providers, improving the access to care, and then helping deliver personalized treatment in the home, moving from a point in time that's periodic and episodic in the clinic to delivering care that's always on or all the time, is where you start getting more preventive in the way that we're managing these conditions, and for patients with these conditions to have a much better healthcare experience. And that's been our experience at not only Prisma Health, but nationally with all of our partners around the country. And I always bring it back to, like, if you think about your parents or grandparents' healthcare experience, and I bring it back to my grandfather specifically, this program probably would have materially changed the quality of his life for the last decade of his life. And I know that our ability to impact even just one person a day that needs our help, whether it's from our care navigators or the clinicians at Prisma Health, for example, it makes a difference in their lives meaningfully. And we get testimonials and patient stories every day that demonstrate that.
That's awesome. And I encourage and all of the listeners to go over to healthsnap.io and check out those testimonials. But for those systems, and mainly the executives who are talking about remote patient monitoring and clinical care programs, and they're looking for vendors, and there's a million and one solutions. There's so many reasons why HealthSnap is really the go-to leader in this market. Samsung, this is all going back to your grandfather. Reasons why, there's so many reasons why systems should implement these programs, but Angela, how this has not only helped, but why other systems should implement a program like HealthSnaps. And then for you, Samson, just why you recommend implementing an RPM is so important and so critical for today's healthcare.
So Connor, we talk to a lot of healthcare systems. Networking, we're in a large healthcare system. We get the opportunity to work with and talk to other colleagues across the United States, and we're all trying to solve the same problem. I mean, chronic conditions. Samson gave you some of the statistics. It's just, it's in our face relative to caring for our patient population. And it's very complex. And I've been a nurse for, way too many years to share on the podcast, but I've also been in the home care space. And so I've seen patients in the hospital setting. I've seen them in the physician practices, and I've been in the home setting. And there are a lot of drivers around health and behaviors that we don't always see when we're in a facility or in the walls of a practice. The ability to get line of sight either through a tool that helps us obtain those clinical biometrics, or through engagement at that patient level really become the drivers of success for a program like this. And I've said earlier, it's not just the equipment itself, it's that comprehensive program. It's the care manager component, it's escalation pathways and communication back to the practices. It's bringing tools to the table that help the clinician do a better job of managing their patients. And it's an ease of workflow that is integrated into Epic that make this solution work. We could put the prettiest devices out there, no matter what the sophistication, but without those rules of engagement to help us get ahead of the curve for negative outcomes for our patients, we wouldn't find success. So I am confident that we can't do this just by the technology alone. It needs to be a very robust program that includes a comprehensive look into the patient's needs, identifying that, and then building a solution that works uniquely with your patients and your population. And, we started in the primary care space. I see our future looking at some of our other populations, whether it be heart failure, diabetes, pulmonology, so we can see some extension into some of our other unique populations as we look at the success of this program and how we could translate that into an even more unique and differentiated model of care into some of our other populations.
Thanks, Angela.
Ultimately, for me, it comes down to HealthSnap aside, the bottom line here is that providing RPM and chronic care management programs is good for patients. It's good for the healthcare system. And so you have to start with that. We know it works and there's evidence there. I think my words of caution, and Angela, I think you'll attest to this, is any system out there that's looking to implement any of these programs, if you're talking to companies in the space, my number one thing is to make sure that make sure the partner has strong clinical ROI and evidence. So start with that. The second is integration with EHRs is not a yes, no question or an answer. It's actually, let me understand the data models. And more importantly, I want to talk to someone that's done this before and that has actually done it successfully. So it's easy to say, yeah, we integrate with all the EHRs. But it's oh, well, where have you done it? What are the actual data models, and get the specific workflows of the purpose of the EHR integration down. Everything from getting discrete data into flow sheets into the EHR to revenue cycle automation to inbound, outbound notes. It has to be that level of detail. The third is making sure that the offering is full service and white labeled. Patients in Prisma Health don't know HealthSnap, but they trust the Prisma brand. And so we take that with sincere pride in the fact that we are an extension of their staff. And we hold our team accountable to work as if they're an employee of Prisma Health and that the standards are set by Prisma Health. And then, I think ultimately at the end of the day, it does come down to understanding that when you've been to one hospital and health system, you've been to one hospital and one health system. There are nuance around the country, whether it's regional differences or technical infrastructure. And so having the ability to have a structure and a program in place, but be flexible to work within the systems that you're partnering within to ensure that the workflows are designed to support their desired outcome and workflow. And starting with that piece of it, having that wrapped around with a really strong evidence-based clinical ROI will lead to the financial outcome that most companies in the space lead with. And to me, again, like I said before, financial ROI and outcome is a result of a strong clinically integrated program that drives the workflows that you're looking for with the partnership, and that the patients, most importantly, are highly engaged and get the value from the delivery of these programs. And that's why we've been able to do what we do, whether it's at Prisma or other health systems, and why we're really excited about the opportunity ahead of us to continue our impact at a national scale. There's, again, half the US population with at least one chronic condition. There's millions of lives to help. And we're really excited about that opportunity to continue to make that difference.
It's exciting, and I can't wait to see where it goes. And I want to thank our audience for listening to this insightful discussion. And of course, our great guest, Samson Magid, the Chief Executive Officer and Co-Founder of HealthSnap, and Angela Orsky, the Senior Vice President of Value-Based Care and Clinical Integration over at Prisma Health, as we explored the innovative remote patient monitoring and chronic care management strategies that HealthSnap provides that are transforming healthcare. We discussed these unique insights into the partnership between these two and the programs between Prisma and HealthSnap that are really changing the game, some of the unique qualities that are really set HealthSnap apart from other solutions that are out there, and I encourage everyone who are listening to take a look about the significant impact of this integrated digital health solution, especially prior to the June 25th conference by Millennium Alliance. This episode will be available before then. So if you'd like to gain some knowledge on leveraging RPM and CCM for better healthcare delivery outcomes, you won't want to miss this great chat. I want to thank both of our guests again, and thanks for tuning in.
Thank you, Connor.